The topic of this conversation is graft counts in hair transplant surgery, and understanding what a graft is, and understanding how there are some folks out there who, in my opinion, are intentionally misleading patients in terms of the number of grafts that they're receiving. So let's talk a little bit about what a graft is and when we're doing hair transplant surgery. Understand that what we do now exclusively across the board is referred to as follicular unit transplantation. That's the gold standard in hair restoration surgery today. Obviously, we have evolved from the old days of plugs, and now we've gone down to doing follicular units. Now, what does that mean exactly? You have to understand that if you were to look at your hair under a microscope, you would see that your hair grows in small bundles, and you can actually see these bundles as they grow together. Some of these bundles are two-haired bundles, some of these bundles are three-haired, some of them are four-haired bundles, and then there's a number of them that are just single-haired bundles. If you look at them all and you were to put them all in their individual categories, the one hairs with the one hairs, the two hairs with the two hairs, the three hairs with the three hairs, etc. Those are what we call follicular units or follicular families. Now, what we talk about, and it is the generally accepted norm in hair transplant surgery and follicular unit transplantation, that the graft is a follicular unit. So when I'm doing hair transplant surgery and I'm talking to a patient across from me and estimating the number of grafts that are going to be necessary, what I'm talking about is follicular units. So if I say I think you need 2,000 grafts or 2,500 grafts or 1,200 grafts, or in a very large case, 3,000 or 3,500 grafts, what I'm referring to specifically are follicular units, and those are grafts that are dissected just as they occur in the scalp. They haven't been tampered with, they haven't been split. We haven't taken a four-haired graft and turned it into two-haired grafts. That's not follicular unit transplantation. Follicular unit transplantation is classically very clear. It is the process by which we move hair from the back of the scalp, having dissected that hair in those individual families that I described, two-hair bundles, three-hair bundles, four-hair bundles, and then reinserting them in that exact same way, in the same bundles that they grew in. Why is that important? It's important because that's what the standard should be. So when you talk about a 2,000 graft case or a 2,500 graft case or a 3,000 graft case, you're talking about follicular units, not individual follicular units that have been split into twos, or a three-haired follicular unit that's been broken down into a two-hair and a one-hair. That's not follicular unit transplantation. So some of these folks out there that are telling patients that they can routinely get them 5,000 and 6,000 grafts, listen, I'm going to tell you flat out that just isn't accurate. I've been doing this for years and have done thousands of cases, and I know my very largest case ever was 4,200 grafts, and that was under very unusual circumstances. So I know for a fact that when someone's telling you they're going to give you 5,000 and 6,000 grafts, they're not giving you the full truth. You notice they're not telling you they're going to give you 5,000 follicular units. They'll specifically tell you that you're going to get 5,000 grafts. So you may have a whole lot of those grafts that have been split out from either a three-haired unit or a four-haired follicular unit into twos or ones. That's not helping you. That's not increasing your density. So that, in my opinion, is sort of sabotaging the effort and is misleading you so that you think that you're getting more value than you really are. And that's a problem, in my opinion. And when I had this conversation with a patient recently, that's exactly what he thought. And so when I explained to him what the reality was, and we sat down and just did the math and talked about what true density is in the back of the scalp and how many follicular units you really could achieve. Now, that's not to say you couldn't get 5,000, 6,000, 7,000 follicular units over the lifetime and maybe come back with a second surgery and easily achieve that number. But it's extremely difficult, if not impossible, to reach those types of numbers in one surgery. And so I would say that if someone's out there that says they can do that, well, I want to be there. I want to see that. I want to count those grafts. I want to see how they're dissecting the tissue, because I know for a fact that it can't be done. It's a very, very rare circumstance when you can see a case come out with a large number in the 4,000 range. And I know that from personal experience, and I know that from working with some of the best surgeons in the world. So I would tell you, patients, use caution, be aware, use common sense, and I hope that this information helps you, because it is the truth. It's flat out straightforward. That's what you need to know. And if you have any questions, you can certainly forward it to me on the website. I'd be happy to address it. I've also put together a little informative article about NeoGraft and the truth about NeoGraft. I'll subsequently be recording a little video about that to just give you my opinion about what's gone on with this whole NeoGraft movement, and see if I can open some eyes as far as that's concerned too. So I hope this is helpful. It's being put together in such a fashion so I can hope that I'm putting it in a situation where it's like I'm talking to you. That's what I want to do. And if you have any suggestions or any topics you'd like to hear about, please forward them to me, and I'd be happy to discuss them with you. But hopefully this is informative and helps you, and maybe even keeps you from potentially making a bad decision about where you get your work done.